Now, the Prime Minister promised the biggest shake-up of mental health provision in 30 years when she first entered Downing Street, and today there were signs of more action from the government. The Health Secretary announced this morning details of a plan to recruit thousands of new staff to help treat an extra million people by 2021. And the growing pressure on the service has been illustrated again by new figures which suggest a 70% rise in the number of men suffering with an eating disorder, as Charlotte Lomas reports.
Jack was 14 when he realised his obsession with food and exercise wasn't normal. He sought help but was astounded by the lack of understanding he received from medical professionals. And Jack's is not a lone case. Since 2010, there's been a 70% increase in males suffering eating disorders.
I feel like there's a lot of box ticking in the system. I feel like there's a lot of concentration on weight. And I know that, I think people need to understand that anorexia is a mental health illness with a byproduct of being weight loss.
To improve mental health services, the government has pledged £1.3 billion. Under the plan, 21,000 NHS posts will be created, including therapists, consultant psychiatrists and nurses, which Health Secretary Jeremy Hunt says will result in an extra 1 million people being treated by 2021.
Yes, we've got to put the money in, but also we've got to have the people there who can actually deliver that care. And I think that's what, in the past, governments on all sides have not done right. They recognise the money bit has to happen, but they haven't got the proper strategic workforce planning right. And that's what we're trying to do today.
While this expansion plan has been welcomed, some say it's unrealistic, particularly given the current shortage of nurses in the NHS. And there's calls for recruitment to start earlier on.
We need to incentivise and engage people who are still at school and in our sixth form and in our further education colleges. We need to engage people in aspiring to come and join mental health services and mental health service teams, to actually want to be a part of a mental health.
6 years on, Jack says he's not recovered from his illness but is able to manage it, setting himself personal goals to stay physically and mentally healthy. Charlotte Lomas, Sky News.